So, respiratory system is divided into upper respiratory system, that is from the nostril, nose to the trachea, and lower respiratory system, that is from the trachea to the last part of the lungs. We call it as alveoli or respiratory bronchiole, and then leading to a structure which is a grape like structure called as alveoli. So, breathing, we divide the breathing into inhalation and exhalation. So, when we take the breath inside, it is due to the contraction of certain group of muscles and the atmospheric pressure changes. So, for example, when there is a contraction of the muscle which will divide your body abdomen into, which will divide your abdomen and thoracic cavity, we call it as diaphragm. So, diaphragm is a major muscle which is responsible for your breathing, inhalation. When the diaphragm contracts, it will create a vacuum inside the chest cavity, and when the intercostal muscles also are contracting, it will create the outer space of the chest will be enhanced, and the inside of the diaphragmatic contraction will create a vacuum inside the chest. This vacuum, and compared to the external atmospheric pressure, there is a vacuum kind of pressure within the chest cavity, and the air from the atmospheric air will be sucked inside. So, that we call it as inhalation. So, inspiration, inhalation. And when the diaphragm relaxes, it goes back and reduces the pressure within the chest cavity, and when the intercostal muscles contract, relaxes, it will reduce the chest circumference, and this one we call it as exhalation. So, diaphragm contracts, the atmospheric pressure reduces within the chest cavity, we take breath in, we call it as inhalation. When the diaphragm relaxes, intercostal muscles relaxes, the chest cavity pressure increases, and then we throw the carbon dioxide out of our system, we call it as exhalation. So, between these two, there is the alveoli which I mentioned, the last structure, grape like structure within the lung cavity, and on the alveoli there is a arteries which are embedded on the top of the alveoli. So, between these two, alveoli and the arteries, there is a gas exchange. Whatever excess in this, inside the blood there will be an excess of carbon dioxide, inside the lungs there will be excess of oxygen. So, oxygen will be taken in and carbon dioxide will be thrown out, and then this way there is a chemical exchange between the respiratory membrane. We call it as respiratory membrane or internal respiration. When we take breath inside with your muscles and other structure, we call it as external respiration. When there is a blood circulation and the gas exchange between the respiratory membrane, we call it as internal respiration.